Welcome to the Egenis. I'm extremely delighted to introduce Sophie Veigl from the University of Vienna, who I think many of us will already know, but I'm going to say some stuff about her work anyway. I think Sophie's research is extremely aligned with a lot of the interests and the sort of values that we have here at Egenis. What we're thinking about a lot of her research is she's kind of thinking through all of these sort of, in a sense, very familiar and important biological concepts like immune systems, heredity, inheritance, by sort of thinking with and at these sort of new sorts of technologies, often tying in very big themes in the philosophy of science, pluralism, relativism, the nature of disagreement, and often with a very strong sort of feminist bent, using a lot of the perspectives and tools from those perspectives. Most importantly, she's also the current holder of the European Wrestling Association Newcomer of the Year award, which surely outshadows any other achievement you could do this year. A common interest that Sophie and I have is in methods in the philosophy of science. We are currently putting together a collected volume on this issue, and I take it that one of the things we're going to get to see today is how Sophie has started using qualitative social scientific methods to think through, so it never occurred to me to think through before, the notion of a testosterone epistemology. So thank you very Sophie.
Thank you so much for the introduction, and thank you so much for having me and the opportunity to present this research. I think it's the first time that I really conceived of what I'm exactly going to do, and I'm also presenting what I did and what I'm trying to do in the future. My project is about how different communities know about testosterone and how that might help us thinking about what epistemic systems are. So
click on to
the Yes, perfect. Okay, so that's the structure of my talk. First, I'm gonna talk a little bit about what kind of different knowledges about testosterone exist, which kind of literatures I consulted in order to navigate through this field. And then I'm gonna start thinking about how can we actually capture these different kind of knowledge systems. Because on the one hand, I will tell you there's this kind of medical knowledge about testosterone, but there's also a lot of use-based knowledges about testosterone. I will then try to argue that in order to really investigate that, we need a case study. And I decided to do a qualitative interview-based case study, and I'm going to show you some preliminary results of me interviewing different people who know a lot about testosterone. And I'm going to sum this all up by trying to think how this kind of particular empirical data can help us in formulating more large-scale accounts of what epistemic systems could be. And I'm going to say they have to be epistemic agent-based. Okay, so I'm going to start with knowledges about testosterone. So that's just a intro into what kind of scholarship already exists about testosterone. I think that's one type of scholarship that is about this kind of essentialism, constructivism line, and what testosterone really is, how it is associated with gender. There are both popular science books and also quite scholarly treatises about that. Then we have, of course, a lot of feminist scholarship about sex hormones and testosterone in particular. For example, there's Anne Foster Sterling, but also Nellie Oxhorn, who have written quite extensively about that. And then lastly, another source that has been quite important for me are ethnographies. So, for example, there is Lee Monaghan, who went to a gym in Wales and observed how bodybuilders are knowing about testosterone. There is Emilia Zanabria, who investigated how testosterone is part of hormonal devices for menstrual suppression in Brazil. But there's also, of course, Paul Preciado's Testo Junkie, which is more of an ethnography about using testosterone and gender hacking. So yeah, there's a lot of different lines of scholarship about testosterone, and I've certainly not mentioned any type of it, but I think another thing that's very important to point towards is that there's also a lot of different scientific, medical contexts that testosterone figures prominently in, right? So we have, for example, testosterone replacement therapy, which is what happens when often middle-aged men experience some symptoms, and these symptoms are then often associated with decreasing levels of testosterone, and then they take testosterone in order to address this. We have PCOS, so polycystic ovary syndrome, which is supposed to be a condition where women or AFAB individuals have like higher levels of testosterone, which causes also some particular symptoms sometimes. We have contexts such as anti-aging, Alzheimer's research, and regeneration. Testosterone is also interesting for contraception, given that the pill usually makes all organs that could produce testosterone stop doing that. So there's always the question of whether we should supply testosterone with contraceptive devices as well. And then there's, of course, also testosterone cycles for bodybuilding purposes. There's gender hacking context where testosterone is mostly used to sort of like subvert and gender and gender binaries. And then there's also, of course, transitioning where testosterone plays an important role. Now, within these contexts, a lot of them are quite gendered. And what I mean by that is that they're often associated to be important for either one or the other gender, which is, of course, not for each of them the case. However, for example, like people who are assigned feminine at birth, for example, they're like polycystic ovary syndrome seems more important, contraception as well. And on the other hand, those who were assigned male at birth are often more associated with testosterone cycling. However, there's also, of course, like women bodybuilders or testosterone replacement therapy. And then there's a whole lot that's in the middle between that. So, for example, anti-aging, Alzheimer's research, regeneration might be more in the middle, even though there are some stereotypes associated with testosterone. For example, testosterone, cognition, these old like male-female binaries. So the whole Alzheimer's thing, of course, isn't free of these kind of gendered contexts. Then also, many contexts are a bit beyond the institutionalized or medical scientific context. And what I mean by that is that there's, of course, a lot of research done within medicine, within science, such as, for example, Alzheimer's research or testosterone replacement therapy, which also seems to be very well guarded within like the medical profession to like do that and prescribe that. But there's also some forms of creating knowledge about testosterone that might be labeled as deviant by, for example, medical practitioners, which could be gender hacking, but also using testosterone in a bodybuilding context. Sometimes it's also prohibited in certain countries. And someday in between, so I put anti-aging and regeneration in between. I think that's very dependent on the country one is looking at. I did that mostly for Austria, where this kind of thing is not really something talked about within the medical system, but it's something that my interviews mention quite often, that is also something they're using it for. So for that, I think it's quite clear that like both medical as well as use-based, and I call them use-based communities, which sometimes might be ethnomedical, meaning that like for a particular part of medicinal knowledge, also pharmacological knowledge, they actually amass quite a lot of knowledge about it. Yeah, both types of communities produce knowledge about testosterone, and the knowledge that is produced within the more institutionalized context is not simply consumed by testosterone users, and there are certain reasons for that. Sometimes medical knowledge doesn't seem to be sufficient because certain contexts, for example, the dosages you use for bodybuilding contexts are just not something there's clinical trials on. So bodybuilders need to talk within STEM to find out about certain risks, for example. Then also medical knowledge is sometimes judged as problematic. So for example, as I will tell you also later, a lot of like transmasculine testosterone users have formed very elaborate critiques of what are problems with medical research being very heteronormative. So some forms of that knowledge just doesn't really apply well. However, there is for sure like complex relations of trust, resistance, dependence, and co-production, because, for example, for the case of transmasculine testosterone users, they often have to see doctors at certain points, and these are like important interactions for them also in some cases to get the substance they know about. So the question of my project is how to conceptualize this relation. And I mean, it has to do something with knowledge systems. And one of the first things that occurred to me that probably terms like scientific paradigms might not work that well, because a lot of the knowledge that is produced here and I'm interested in is produced outside of like what is institutionally understood as science. Within our philosophical toolbox, there's another concept called epistemic systems that seems a bit broader. However, epistemic systems are also way less defined than scientific paradigms and all the other concepts we have in science to describe ways of doing research, such as scientific, such as systems of practice or epistemic repertoires and so on and so forth. There's another thing that is not quite clear about epistemic systems, which is like how they relate to like science-based knowledge systems. So I haven't stumbled across like literature that would like exactly tell how an epistemic system is different to a scientific paradigm. Like, is it broader? Does one contain the other? And so on and so forth. But a kind of definition you will use and you usually find in the epistemology literature very often when people talk about epistemic relativism or disagreement is that epistemic systems and scientific paradigms or like scientific knowledge systems in general are somewhat distinct. And epistemic systems are often defined as a set of more or less coherent epistemic principles, where epistemic principles would be a rule that sanctions how to acquire knowledge. So for example, what is a good source? How do I define good evidence? And so on and so forth. Now, like one of the questions I already pointed to is like, how do epistemic systems relate to scientific knowledge systems? But there's also a bunch of other questions. For example, does every epistemic agent apply epistemic principles in the same way? So if we stop thinking about just epistemic principles, that is often done when people talk about epistemic systems, but think about the epistemic agents that are somehow they are within these epistemic systems, it starts feeling kind of intuitive that everyone would do exactly the same, but there's not really literature on how to handle variation within epistemic systems and what are good criteria of, well, this is a variation within, and this is now an instance of two different epistemic systems, for example. This also leads to the question of how are principles renegotiated, how do they change over time, because epistemic systems don't seem to be stable. I think the history of science is a very good case study of showing us that. Also, as I said before, how do scientific principles relate to more general principles? Are they just like derived from them? And that's a pretty clear relation. And also, does every epistemic agent have the same epistemic authority? So like the issue of epistemic power is usually also something that hasn't been discussed yet in this epistemology literature on epistemic systems, fundamental disagreement, relativism. So I use my case study to actually tackle a couple of tasks, and some of them I will talk about in this talk. One is to find a better characterization of epistemic systems that takes epistemic agents and their heterogeneities and their variation into account and don't go for this very idealized epistemic principles kind of approaches. Also to know a bit more about the relation between epistemic systems and scientific paradigms or scientific knowledge systems in more general. Also, of course, it offered itself to look at some expert-led dichotomies and how much sense they make with regards to my particular case study. Also take non-propositional aspects of knowledge into account, like, for example, embodiment and the body as an epistemic tool. But also explore epistemic power as a variable in knowledge relations, because as I tried to hint already, it's not that like everyone who uses testosterone has the same power, because some people are dependent on others, for example. So this is my case study design. So I performed 25 interviews with roughly 4 different kinds of representatives of people who know stuff about testosterone. I interviewed 6 urologists, but primarily within testosterone replacement therapy and andrology, 5 gynecologists and endocrinologists that were primarily involved with trans healthcare. This is an Austrian thing. I think in different countries, different medical professionals do different things in this kind of, the things are split up differently. So don't be confused why it is like that. That's just the way I found, the divide and conquer being done in Austria. I then interviewed 6 testosterone users in bodybuilding, MMA, sports entertainment context. So this is like a more also a heterogeneous group, because of course these 3 contexts are also not exactly the same, but broadly what these people were using it for is like growing bigger. And a transmasculine testosterone users I interviewed as well. As I said before, most of them are people from Austria, so most of them were white. However, there were some variations, so I talked to some people in Germany and Switzerland as well. My case study design was to ask, to structure my interviews around like 4 themes to this, so to say, which was discussing ways interviews thought were best to acquire knowledge about testosterone, how their knowledge relationships work, so who would they trust, who would they ask if they want to know more about testosterone, how they think that testosterone, their body, and knowledge about testosterone are related, and then also how they thought that testosterone masculinity would be connected or would not be connected. Interviews were transcribed and coded, so I did it quite inductively, of course, with having some particular interest in things like evidence and so on in mind. So I would say it was a grounded theory-inspired approach, and I tried to identify common themes and discrepancies regarding notions about sources, evidence, who are competent knowledge, expertise, and trust. One thing I also did is try to color that people were rather referring to some epistemological aspects of knowing about testosterone or some ontological aspects about what testosterone is, because I was also interested in how they thought about what testosterone is, reflects how they think to know best about testosterone. And I think also this activity was kind of interesting because often it wasn't quite clear, and often it was, of course, mixed cases, but just to show you an example, this is not incredibly helpful because it's in German. However, what I'm trying to show to you is like, in my case, like pink is epistemic and blue is more ontological. And I saw in my larger course where some were quite like more epistemic in general and others would be very nicely mixed. So this is, for example, one about knowing about your own body, where like a lot of like ontological themes about like what testosterone is and how it is like to feel were like very much mixed. Yeah, the goal of my case study, as I said before, was like twofold. On the one hand, seeing how what intuitions do epistemic ages express about good ways of gaining knowledge about testosterone, and how are their beliefs about what testosterone is, and how to know best about it linked. And I will go now through some very preliminary results. So I have to say that I finished coding probably 2 weeks ago. So this is something very, very early and only very roughly interpretative, but I still thought that some things are quite interesting, but I also invite you to give me all your thoughts about like how I did that and what I found interesting and what you might find interesting that I didn't mention, and so on and so forth. So the first thing I'm going to talk about is something I guess that's very expectable from the kind of questions I ask and the kind of sample I have, which is like variation with regards to what the different interviewees think is good evidence, and variation with regards to what the different interviewees think who is an expert about testosterone. So first one is what is good evidence, and I'm going through like several quotes. First one is, it's good evidence when it's an experience a lot of people have had. So which says something about, well, if we share in our community and a lot of people say something that has happened when they took testosterone, that's for me like good evidence for thinking this might also happen to me, for example. This was from a transmasculine testosterone user. The next one is, well, in the end, that you try it yourself and experience yourself if it's true or not, which is like from a bodybuilder and also like an epistemically kind of, yeah, not the best position to be in, that ultimately you do have to like try it out yourself, and this will be the evidence, and there's not really a lot a priori that you can take as a good source that something will happen to you or no. Then, of course, something very similar, which is like when you see that you build more muscle, like also really tying it to a particular outcome, and as to also some like features people think testosterone has. And then also not very surprisingly, the best evidence is brought by a randomized control trial, which was like from an endocrinologist who works at a hospital in Austria and does a lot of research on it. Next question was, who is an expert? This is by a urologist who I think practiced for 40 years. It says, well, an expert is someone who goes to conferences, who applies the knowledge, who monitors the patient thoroughly. That's all. What we do with testosterone is no rocket science, which is also a very interesting notion, because a lot of urologists who mainly treated like cis males would always portray testosterone as this really simple substance where all the evidence has been gathered 30 years ago, and there's like nothing really special to it. It's really easy to administer. It's like really closed substance when no one actually has to like negotiate a lot about it. Then this is the account of a bodybuilder who's a woman who also raises the importance of like knowing like of the difference between men and women when they take testosterone. And she described her trainer as an expert because, well, he said he reads many studies. He has consulting calls with many experienced trainers where they discuss their clients as cases prior to making a decision. You gotta have some physiological knowledge, know about a woman's cycle, know how and why hormones work which way. As I said, doctors don't know much in this area. So she was actually very frustrated with the medical system and would like tell me a lot of instances where neither a gynecologist or a general physician would at all be able to like read her blood work or tell her anything about risk and so on and so forth. So her trust was like completely like in the bodybuilding community with like more experienced trainers who also have this practice that's sort of like mimicked after what like doctors do, right? Case reports and case studies that they also share between each other. And then another thing she added, which I thought was very interesting, was like when I asked her about why don't doctors know much about this, she would say, well, the problem with science is that you always work with the average and we are not average people. Another take on who is an expert was also by a transmasculine testosterone user who was also very upset with the situation that the doctors wouldn't know a lot of things, particularly when it goes into the particulars of them taking testosterone and possible things happening. And this was, well, I developed vaginal atrophy, which is also normal for menopausal women, and nobody could help me. They just tried one product after the other, but no one suggested to take some preventive measures. I have the feeling that I mostly the doctors and stuff they would only say was like, I also don't know more about it. This person uses this product, so you might as well try it. So a not very scholarly way of dealing with the problem. And that's also by a transmasculine testosterone users who defined very nicely who they thought could be an expert about testosterone, and what they would say was, well, I would really question whether doctors can really be testosterone experts. A good sign for me that someone is an expert is that they do not only use it, but also visit trans circles or care for other trans people in their day job. So they had this like combination of, on the one hand, knowing about it through using it, but also knowing about it through like gathering a lot of other experiences and working in this field through social work or like just like facilitating exchange. Now, after having gone through these two examples of like how my interviews varied with regards to their intuitions of like what's knowledge, who's a good expert, what's good evidence, I'm extracting 4 preliminary directions that I thought very interesting about my sample. One is about the community structure and its relation to knowledge. Next one is about individually versus standardization. Then I'm going to talk a little bit about knowledgeability, and at last ontology, meaning how what interviewers thought testosterone was also linked to how they thought one can best know about it. So what I think is also not very surprising is that the community structures my interviewee were living in really affected the relation to the institutional medical knowledge. So for example, for many transmasculine interviewees, they had a lot of access and a shared repertoire of critiquing heteronormative medicine and just formulating reasons for distrust. So they linked a lot of shared histories, shared community experience to a particular way of critiquing science, and that also applying to like their reasons for trust, for example. Experience sharing in this community was portrayed as a community norm, so something that is done quite often and very encouraged. And also community-based sources, so like gathering the experience of a lot of people or also more experienced people was often seen as superior if compared to information provided by doctors. For the bodybuilding communities, it was a bit different because it seemed way more isolated. On the one hand, I think what can be said quite generally, usually the hierarchies in the community will be much stronger. So there will be particular trainers or people who just have been quite long in the business who are like the hierarchical sources of knowledge. And it's not that easy to like go through these hierarchical steps. And interestingly, like access to medical knowledge is often problematic and highly gate-kept, meaning most of them cannot go to the doctor and ask something because they feel like they will be judged as like criminals, drug users, and so on and so forth. And they also don't really trust that people know what they need, which kind of tests they would particularly require, and so on and so forth. But trust within the community is also really an issue because sharing information is not a trivial matter. On the one hand, because in Austria it's illegal, so you can't just tell anyone. It's also associated with some kind of cheating connotation, so people don't really want to like expose it about it because then others will think, well, they haven't put in any work. Outsider prejudice also really influences secrecy, so they also talk about occasions where like they are in the hospital for something else and doctors will just like talk about them, oh, look at them, like in their bodies it's like inscribed that they do this like bad criminal past, and in a way they only see them through that, so they prefer that it's not like readable. Some are also really proud if like in their blood work it doesn't show up, then they feel like they've tricked it or had like a really smart use. And also something that I found really interesting is that like good or smart use or having the relevant knowledge for using it a particular way is inscribed in the body. So for example, interviews would say, well, if some people have these and these types of skin problems, then this shows they don't know much about like how to take it, and that's why they are not a good source. So like bodily appearance, particularly regarding side effects of like taking testosterone, was really associated with like who's a good source on that. Yeah. Well, many of the doctors and medical practitioners I talked about disparage the experimental approaches towards testosterone intake, meaning like making one's own decisions about dosages, for example, deciding for a non-binary dosage, but also probably stopping taking testosterone for after a particular time in the transmasculine context, but also, of course, in the bodybuilding context, which would be experimental outside of the medical context altogether. It had a positive connotation in both use-based contexts. So both interviewees who are transmasculine and also bodybuilders would say, well, we do something that is like experiments. I mean, it's in our own bodies, but we also like collect this data, which could be important for others. And they influence their individuality. So I felt like in their account, the world was way more disorderly than like how doctors would talk about it. For doctors, it would be more, okay, there's the statistics, and like that's like a normal way to go, and there might be some outliers. And interviewees would rather like really view everybody as like individual and special, and like would have to be taken care about for its own. And also the argument, well, there is no long-term data available, like from medicine, like there haven't been very long-term studies on, for example, taking testosterone as a transmasculine person. So they feel they are just themselves lab, right? So it's also okay for them if there's not really good knowledge about certain things within the institutional context. It's fair that they experiment by their own because they don't get the knowledge they want somewhere else. Now, this individuality versus standardization was also like a theme that they talk quite a lot about. So in use-based context, first-hand experience was very central and a very direct source of knowledge. And interviewers also approved sharing this knowledge. But what was very important in both for bodybuilders and transmasculine testosterone users, they would police representing it as meaning like as a more global reference point. So they would say, well, if someone just talks about their own experience and doesn't really contextualize this is something that happened to them and doesn't have to happen the same way, this would also not be a good source, for example. For medical practitioners, this form of knowledge, so like experiential knowledge by their clients, was sometimes mentioned to be used on rare occasions when they could like use it anecdotally for another patient, but like there wasn't really much talk about that. What I also thought very interesting is that while individuality is emphasized in both of these communities, in the bodybuilding community, there was like a particular readout to what like good, smart, proficient use is, which is something about how bodies at the point would look. However, this was really frowned upon with transmasculine interviewees, so you shouldn't like think that there are some particular bodily features, for example, that are the goals of a transition, and so it's not something that you can associate with how bodies look like, how well someone used testosterone. Regarding the knowledgeability, I had the impression that medical practitioners had often like quite positive attitudes towards their patients' medical knowledge. Often, like if it assisted the compliance, so they were quite happy if they came in and already knew a lot about testosterone because they thought, well, that makes it easier to just like give them a prescription and then they're off like doing their stuff. The urologists I talk about, who were outside the hospital mostly, rejected all knowledge about testosterone in the bodybuilding context as deviant, risky, and also irrational in a way. Well, they know all the risks, they still do it. While when someone like that comes to me, I'm stepping back and I am not treating them and I'm not abusing, I don't know, my knowledge and my contracts with certain like suppliers for them. Yeah, as I said before, for many bodybuilders, instead, medical knowledge was highly desirable but not accessible. And they also took like pride in hiding their testosterone use when they were like in medical contexts. Also, I think that also shouldn't come as a surprise. Knowledgeability and expertise came for the use-based context as something that could be multiply realized. So they would never say, well, there's nothing there in medical knowledge. It just would say, well, it's not really a hierarchy. It's way more dynamic. There are different contexts in which, like, for example, the experience of other people in my community are just way more valuable than things I could like get from medical knowledge. Contrarily, for medical practitioners, they would see expertise quite exclusively located in medical education and in the medical profession. Now, the last thing of my very preliminary interpretation is the question what testosterone is and how this is linked to knowing about it. And I think there are some very interesting things extractable. For example, what I found is that, as I told you before, in the bodybuilding context, like what testosterone is supposed to do, so its effect as an entity has a lot to do with like what person is a good source because they look a certain way, they could have like manifested certain things testosterone is supposed to do in the body. Also, depending on the context, I found that testosterone sort of like oscillates from a natural to an artificial kind. So in a way of like, in some contexts, testosterone was seen as this like very fixed molecular entity that is somehow like the essence of masculinity and has this sort of virilizing effects. So this was both true, I would say, for the urologists, but also most bodybuilders who were using it. However, I felt like in the transmasculine community, it was more of a like artificial kinds and not quite a social kind, because of course, like there is something out there in the world that our activities refer to. However, they also acknowledged a lot of like social construction and of the classifications of its effects. So it's somewhere in between like a natural and a social kind in a way. Now, taking this all back to talking about epistemic systems and what could such like cues one gets from this kind of interviewing have for theorizing about that. No. Yes, that's okay. Yeah, so I think my interviews reveal certain variations in intuitions about certain epistemic principles, particularly when it comes to knowledge about testosterone. I think there are some commonalities that the different communities shows. However, it's also important that within these communities, there's also some variation. So it's not that they are like homogeneous. I just think there is like a way to generalize a bit within these communities about some general themes. Importantly, there are also power relations between these communities. For instance, to a degree, transmasculine and bodybuilding communities depend on knowledge produced in institutionalized medical contexts. And in some situations, compliance is necessary. So, for example, the extremely elaborate commentary of a lot of like transmasculine testosterone users about medical knowledge and what is problematic about it, they don't use it when they talk to a doctor, even though they could. There, it's way more important to comply with like the doctor's interpretations of epistemic principles. However, while there's this kind of dependence, or there's this kind of power, there's also resistance, because within the different communities, different hierarchies of types of knowledge are assembled. As I said, both transmasculine and bodybuilding interviewees acknowledge that they're not standard subjects, so certain claims of evidence-based medicines doesn't really apply to them. And thus, like, they order different sources, different kinds of evidence differently. So, for example, a systematic review or a randomized controlled trial just doesn't score very highly with them for good evidence. Now, how to deliver an account of epistemic systems based on these observations? So I think, and I hope this has illustrated that, like, an account of epistemic systems that primarily focuses on some few highly idealized epistemic principles will be unable to capture knowledge dynamics within the systems and also between the systems, because it's just not the case that everyone within the systems has exactly the same intuitions about what are good ways of gaining knowledge. When we idealize, we might be able to capture either majority positions or just powerful positions, but certainly not like what all epistemic agents in a particular system think. So I aim at doing the reverse and extract epistemic systems from knowledge practices and the negotiation. Doing that, and that's like the only like theory heavy part of this presentation, is that I'm very inspired by meaning finitism as a position to develop this account. To, on the one hand, capture variation of intuitions about principles, aggregation of certain intuitions. Just skip the slide. Yes, sorry, I skipped the important slide. Okay, so I'm employing a meaning finitism model of rule following. And there are some like key tenets I take that to have. One is that no epistemic agent has perfect knowledge and grasp of all the epistemic principles, but rather has intuitions in concrete situations about instances of applications of an epistemic principles. However, these intuitions are conditioned by prior instances and examples, so meaning like prior instances where a particular rule was followed, they know about, they use that to judge whether this concrete instance is also a good example of following the rule. And of course, there are always contingent factors of the situation of judgment, which can be historical, political, something very local to that particular, instance. So every formulation of an epistemic principle is an idealization of a pattern of principle following behavior. So there's no such thing as like a big epistemic principle, we might access intuitions about epistemic principles and the variation of these epistemic principles. So then expecting a lot of variation also helps to find like aggregation of certain intuitions. So some might just occur more often than others and might aggregate with certain groups. There might be also different emphases on different principles, so different epistemic agents might just like order the importance of different principles differently. However, we can still acknowledge the role of competence and dominant interpretation. So just because someone has a particular interpretation often does mean they need to respond to certain majority interpretations. But this also means if epistemic principles are constantly renegotiated, epistemic systems are inherently social, and we do have, if we give an account of epistemic systems, to account also for power structures within and between them. So while there's some interesting variation, all interviewees of mine share many intuitions. And like one reason for that is, well, the group is not that heterogeneous. They're all like white middle-class Austrians, most of them. But I think that's an issue for most cases of different epistemic systems. So because if we cast our net wide enough, it might be possible for any case of disagreement. For example, think about like the famous case of Galileo disagreeing with Bellarmine. A lot of people try to show, well, actually they agreed on so many things, just to have their disagreement about a particular interpretation of like how to treat or how to interpret the Bible with regard to that particular instance. So, or for example, take also another famous example of epistemic relativism, where, for example, a flat earther would disagree with an evolutionary biologist about like what is a good source for knowing about the age of the earth. And one would say, well, it's the Bible, and the other would say, well, it's a geology book, for instance. If I would just say, well, you know, in a way we could generalize that, and they really agree that books are a good source in general. This really doesn't help us, right? The disagreement is still there. We can be, but if we cast the word wide enough, we can say, well, they are with regard to that in the same epistemic systems, but like the disagreement is still interesting, and we haven't really resolved it. And they would never agree that by realizing that they could like resolve the disagreement. So what I posit makes more sense is to say, well, epistemic systems might only be identifiable with regard to a particular domain of reference, which is, in my case, for my case study, knowledge about testosterone. So we have to move from idealization to accounts that are drawn from particular knowledge practices, but which are also only applicable with regard to that particular domain of reference. So this is a this is my art. Where we could have, for instance, like three epistemic systems that concern a particular domain, which in my case was knowledge about testosterone. And the important thing here is also that, like, as I said before, the intuitions about what testosterone is might be different for these different systems, and could, of course, then also create further difference between the epistemic systems. But the question is, well, how do epistemic agents assemble the epistemic systems for this particular reference domain? So what is out there in a way? Because, of course, there's also other things than knowledge about testosterone in our lives. And then going back to this like meaning finitized picture, by saying, well, I mean, they have also access to exemplars, meaning instance of rule-following behavior in more general scenarios or other reference domains. But the diet of exemplars will be different for proponents of different epistemic systems. So I call this like the finitized exemplar soup. So this is sort of like surrounding us. This is like our epistemic lives. And of course, we can access these things when we say something particular about a particular reference domain and knowing about it. But this could also lead to important differences, right? So I was so IP means intuitions about a particular epistemic principles. Some of them might be shared in two different epistemic systems. Some of them might be like ranked higher in one and ranked lower in the other. Some might actively like reference but reject a particular epistemic principle. And some epistemic principles or intuitions about it might just be present in one and not the other. And of course, like some, if not all of these principles present in these systems also interact with like intuitions about what the particular reference domain, testosterone in my case, is. So, for example, surrounding the assembly of an epistemic system, it becomes possible to approach also power structure between and surrounding epistemic systems. For example, I think how transmasculine testosterone users refer to certain ways of getting knowledge, but actively rejecting it. This really shows, well, they know this is a dominant way of interpreting or of ranking a particular principle, and they actively take a stance against it. So just because something is intelligible to them, for example, that this is like a principle of evidence-based medicine, doesn't mean that they disagree less with people who rank it very highly. Because also epistemic systems are not closed off. Even though testosterone users resist certain mainstream interpretations about how to gain knowledge about testosterone, they're in some ways dependent on these interpretations, since much of the knowledge they depend on is produced in particular mainstream contexts. And so they can sometimes breach fundamental difference if it is necessary. So this can also be a rhetorical strategy. But with regards to epistemic power, different systems might not be on a par, which is an important component also for the disagreement they generate. So while epistemic agents partake in the renegotiation of epistemic principles, not every epistemic agent or community of epistemic agents has the same epistemic agency and the same degree of epistemic power and epistemic status, meaning that the rule book, also the access to the overall finitized example soup, might be different for people with different localizations and with, who are members of different epistemic systems. Thus, I think also like traditional criteria for discerning different epistemic systems do not really apply. So they think that like, okay, if you're part of different epistemic systems, the other one cannot be intelligible for you, or that there has to be a principle irresolvability might also not work very well. Incommensurability can also be a question, since the question is what the criteria would be for that and how we handle, for example, rhetorical applications. And also the question of how many principles have to be fundamentally different in order to return to epistemic systems might just not be the right question to ask. So I conclude that an epistemic agent-based account of epistemic systems helps highlight knowledge dynamics within differentially situated knowledge and knowledge communities, and it locates epistemic systems exclusively with regards to a particular reference domain, where not only intuitions about epistemic principles, but also intuitions about what a particular referent is, differ and generate disagreements. It is not a particular number of epistemic principles that need to be fundamentally different, but it is a combination of intuitions about knowledge and ontology that generate fundamental disagreement with regards to a particular reference domain. At the same time, epistemic power and power dynamics between epistemic systems need to be accounted as an important factor shaping intuitions about epistemic principles. And with that, I'm excited for your questions.